All right, well, it is not an easy topic that is easy to talk about, but if you have a friend or a family member who is at the end of his or her life, you want the best support and services for them possible as they're about to transition. And we've got Suzie with Advanced Home Care and Sharon with San Diego Hospice here. And ladies, it's wonderful to have you on today, because although it's tough to talk about, getting everything in line and helping your friend or family member transition is really the most loving thing you can do.
Absolutely. Yes, we absolutely agree.
With the home care, we're going to talk first about what you do, and then hospice, how you guys are pairing up together so you can have your family or friend get the best treatment possible.
That's exactly right.
Yeah, let's start with you and talk about what services you offer.
Well, we offer anything from 2 to 24 hours per day of care. So it could be anyone that just needs just a few hours of maybe daily errands and just help around the home. And medication reminders to someone that is truly bedbound and needs someone there to be turning them, repositioning them 24 hours a day. So we're there at all aspects. It could be from just a few hours to 24 hours.
Your services may be covered by long-term insurance.
Yes.
If that's not the case, then people are paying out of pocket.
That is correct. It would be privately paid. Sometimes too there are benefits, things like VA benefits that can also help, and so we try to aid and assist in that regard. But normally, yes, it would be privately paid or long-term care.
And Sharon, that's where you come in, because hospice, such a loving organization, along with the home care, you guys fill in the blank, so to speak, in some of the places where people may need some extra care that just may help assist in the whole element.
So individuals and their family members will probably need care at the end of life that is more than just nursing or medical care. They will need help with some of the emotional issues, spiritual issues. They need the whole team. And hospice will help to oversee all of that level of care. But what we find is in so many families, there needs to be additional help with the hourly care, the shift care. We have spouses who are elderly and frail themselves. We have daughters, family members who have to be out of the house to work, who aren't even living in the area. So those individuals need someone who can be there 12 hours, 24 hours around the clock. And what hospice will do with our team that's assigned to that individual is help to oversee the care and provide the full team approach to deal with all of those issues that happen at the end of life.
Yeah. Sometimes this happens and sometimes this doesn't, but to be able to experience the end of life in your own home can be really a gift for the family, and that is something that you guys together aim to do if it's possible.
Absolutely. We want to help seniors be able to stay at home. Some people just want to be in their home. They never want to go to a nursing home or assisted living, and so certainly we help that make that happen.
And I think at the end of life, it can be, I would imagine, an empowering experience to be able to do that in a place that's comfortable, that's loving, where you're surrounded by people, and that you don't have to go into a different facility.
That's absolutely right.
The truth is that all of us would rather spend our time at home where we can get what we need in a familiar environment. So San Diego Hospice is managing care for probably 1,200 families right now, and the majority of that, by far the majority of that, is in their home, which might be their residence, it might be a residential assisted living board and care, it might even be in a skilled facility, wherever that patient is calling home.
Now, you have an offer for our viewers today, because this is something that you want to make people aware of. They may not even know it exists here in our community, and you just want to get the word out.
That's exactly right. Well, we're a private, caregiver agency, so, as we talked about, we offer anywhere from a few hours per day, from someone that's just had maybe a hip repair to, someone that requires hospice care and 24-hour care. So what we're offering is the first 8 hours free, for someone that wants to try to have care at home. Maybe they're just being released from the hospital. Maybe they are at home with hospice care now. We'd like to offer those first 8 hours free, and the proof is in the pudding. If they're happy, we're very confident with our people. These are people that I've worked with for many, many years. We never get anyone out of the newspaper. My mother started the first private hire agency 35 years ago, so I know my people well, and we use them specifically if they're for hospice care, if they're for, you know, just needing home health care, or if they've got this, you know, a fracture, something like that. So it's specific needs and it's individual.
Wonderful.
So 8 hours of free service. Where can you get that?
Sign me up right now.
Right.
Suzie and Sharon, thank you so much both for coming
Thank you.
on today, and hope our viewers can take advantage of your great deal.
Great.
Thanks so much,
Thanks.
ladies. More information, please check out our website at san diego6.com and click on San Diego Living.